Hi, Sommer. I'm Shae. I'm going to be the nurse taking care of you today. And I just am going to ask you a few questions if that's all right with you. If you need any breaks or anything like that, you just let me know. But I just have a few questions to ask you, okay?
Okay,
Okay, can you tell me your full name and how old you are?
my name is Summer Blake and I'm 22.
Okay, Sommer. Do you know why you're here today?
I have mono and my doctor said that I'm underweight and he is really worried about it. Um, that doesn't make sense to me because I think that I'm a little heavy. So,
You think that you're heavy? Are you wanting to lose any weight?
yeah, I think I probably should. It's just so hard. I don't know.
And is anyone making you feel this way, or do you just feel this way you're on your own?
No, I just feel this way. I kind of always felt this way. I was really unhealthy when I was younger, and I got some treatment. Um, I had to go to the hospital my senior year. I was really underweight, I guess. That's what they said. So I needed some treatment. And when I got out, I go see someone to evaluate my meds every 3 months. And I go to a therapist once a week. So
Okay.
I felt like it was under control. I think I just have mono.
Okay. You had just mentioned that you take some medication. Can you tell me what medication you do take?
Yeah, I'm on Zyprexa 5 milligrams. I take it every day, every morning when I get up.
Okay. Do you think that is helping you at all? Do you have a change, or do you feel any change whenever you take it or don't take it?
I think it worked. I mean, I haven't had any issues. Like, I haven't been trying to make myself throw up or anything. So I think it's probably working just fine. Mm.
Okay. Um, Summer, can you tell me some current and past coping strategies you've used to kind of deal with stress in your life?
Well, I hang out with my friends enough, I guess. I listen to music and I was doing yoga for a while there. And I also have a dog. Her name's Dixie. She lives with me.
All right. And what do you expect from being here today, like for treatment?
Well, I don't really think that I should be here. I mean, I think I just have mono. I might need, the doctor says that I'm not healthy, so I should probably go to therapy some more or something, but I don't think I need to be in the hospital.
Okay. Sommer, if you could just tell me what gives your life meaning and what gives you strength and hope.
Um, well, I'm really good at everything that I do. So pushing to be the best is my goal in life, I guess, what gives me meaning. And I'm hoping that by being the best, I'll be able to help more people. So I guess that's my strength and hope. Um, I don't know.
Okay. Would you say that you kind of strive for perfection almost?
Yeah, yeah, I do.
And do you remember a time when you didn't, or has that always been a part of you?
That's always been a part of me.
Okay. Um, who do you turn to in times of stress or a crisis situation, Summer?
I usually rely on my family and friends, but lately, just been feeling really busy, and I haven't really had much time to be around them. Um, College is just a lot right now. It's my senior semester, so I'm just trying to buckle down and get it all done and get it all done the right way. So,
Okay. Um, talking about self-esteem, Sommer, on a scale of 1 to 10, um, will you kind of, okay. Can you rank your self-esteem on a scale of 1 to 10, with 10 being the highest for me?
I'd say probably a 4 most days.
Okay. Um, can you tell me some things that you like about yourself?
I'm really good at my job. Um, I'm good at school. I get good grades. Um, and I'm good at taking care of my dog.
Okay. Can you tell me some things that you might want to change about yourself?
I'm too heavy. I can't exercise as much as I'd like. Um, I get tired. And then I really have been struggling to focus lately, and I just need to get a handle on that.
Okay. You said you're very good at your job. What do you do for a living?
I work at the local hospital as a nurse extern until I graduate.
And you're going to graduate with your bachelor's of nursing?
Mm-hmm.
Okay. Um, okay, Summer, I'm just going to ask you a few tough questions. You don't have to answer them if they make you uncomfortable.
Okay.
Do you have any history of sexual or physical abuse in any way? Or if you had a boyfriend, was he ever violent to you?
No.
Okay. Are you sexually active at all, Summer?
I was. I broke up with my boyfriend at Christmas break. I plan to move after graduation, and so I just thought it would be better to break ties now and focus on school.
Okay.
So I'm not right now.
Okay. Did y'all use any kind of protection from pregnancy or STDs?
Yeah, I took birth control, and we both got STD tested at the beginning, so we didn't have to wear condoms, use condoms. Um, we just did the STD testing.
Okay. Summer, do you have any kind of history of drug or alcohol abuse? Do you use any drugs or alcohol currently?
No, I have socially drank a few times, and I don't like the fuzzy feeling in my head, and I don't like feeling bad the next day, so I just don't anymore.
Okay, can you kind of explain why you don't like that fuzzy feeling? Is it more it makes you sick, or is it kind of a loss of control for you?
It's probably the control thing. I just like to know what's going on and be aware of my surroundings all the time.
Okay. Um, Summer, so can you describe your support system that you have currently?
Well, like my family and friends would be there for me. I just get a little overwhelmed, and I don't really know how to talk to them about it once I get like in my own head and by myself. But they're there for me if I need them. So
So you feel supported by your support system.
mhm.
Okay. Um, so let's kind of talk about your childhood just a little bit. Were you ever disciplined at home as a child or even currently?
um, yeah, when I was growing up and through high school and stuff, I mean, when I was super young, like probably until I was 9 or 10-ish, they would spank me if I did something bad, which I didn't do very often. Um, but then as I got older, if I talked back or messed up, they would just ground me in my room. I had to sit on the middle of my bed and I couldn't read my books or play with any toys or anything like that.
How did that make you feel? Do you remember?
Um, Honestly, just really bored. I really enjoyed reading and I hated sitting on my bed by myself doing nothing.
Okay. Sommer, can you describe your relationship with your friends or with your peers?
Um, I would say it's pretty good. I don't have a lot of friends. I just have a few, but they're really close to me. Um, we don't have to talk all the time to stay close. It's kind of like if I were to call her tomorrow, we would just pick up where we left her off. So I don't know. I think I have really good friends. I just don't have very many.
Okay. How would you describe your appetite at all right now and just in general?
I don't get hungry very often. I eat because I know I have to, but I don't really like it, and I just haven't really been hungry.
Okay, can you have you had any weight loss or gain in um, what kind of like what period of time have you gained or lost any weight recently?
Um, well, they weighed me today at the doctor's office, and they said I weigh 100 pounds. Um, Last time I checked, I weighed 120 pounds. That was probably around Christmas, maybe before. So I guess about 20 pounds in the last 2 months, but it doesn't feel like it.
Okay. Are you active or do you exercise a lot? Do you enjoy exercise?
Yeah, I really do like to exercise. I run on the treadmill while I study. I read somewhere that if you're physically active while you're intaking new information, like it sticks better in your brain. So I run on the treadmill because I think it's gonna help me like retain information better. And probably is like 3 or 4 hours every day to make sure I cover all the material. Um, Maybe 5, but that would be a long time. So I don't think I run that much, but um, I do that every day.
So you do that 7 days a week?
Yeah, school's a lot, so I have to study every day, and I think that helps me remember stuff. So that's yeah.
Okay. Um, Summer, about how many hours of sleep do you get a night?
Um, Probably 4 to 5.
Have you had any difficulty falling asleep in the past or present?
Yeah. When I lay down to go to bed, I think about everything that I haven't done yet that day, or that I could have done, or that I have to do the next day. So I do struggle to fall asleep sometimes.
Okay. Um, Summer, I'm just going to ask you a little bit about your family history, if that's okay. So, do your parents have any kind of history of a mental illness or any kind of illness?
Not that I know of. No.
Okay. And do you have any siblings?
Yeah, I have 2 sisters.
Okay. Do they have any sort of mental illness that they're dealing with?
No, I don't think so.
Okay. Summer, can you list 3 strengths that you have in your opinion?
Um, Well, I exercise a lot, which is supposed to be healthy for you. I I'm very organized. I use my planner for everything. I keep track of all my assignments and my work schedule and stuff like that. Um, and I get A's in school, so that's a strength too.
Summer, if you could just describe your current mood for me.
Um, I think I'm anxious because I don't really think I need to be here. Also, I'm a little anxious about what life looks like after graduation. And the more I think about it, I think I am probably a little depressed. But right now, I think I'm just anxious.
Okay. Does that big life change kind of cause a stressor for you?
Yeah, I just don't know where exactly I'm supposed to go after graduation. I mean, school is all that I've known. So,
And do you kind of feel like have like a loss of control?
yeah.
Okay. So I'm gonna ask you a few questions again that are a little touchy. So if anything makes you uncomfortable, we can stop.
Okay.
Um, have you ever thought about killing yourself?
No,
Okay. Have you ever thought about killing somebody else?
no.
Okay. On a scale of 1 to 10, with 10 being the highest, how would you rank your depression if you have any?
Um, probably, probably about a 4.
Okay.
Yeah.
Um, do you have any sort of hallucinations, whether that be auditory or visual?
No.
Have you ever had any hallucinations in the past?
No.
All right. Do you know where you are currently?
Yeah, I'm at the hospital.
Okay. And do you know what today's date is?
February 12th.
Okay. Um, so I'm just going to tell you 3 words and I want you to repeat them back to me after I say them.
Okay.
So it's pen, light, and bulb.
Pen, light, bulb.
Okay. Do you remember what you had for dinner last night?
Yeah, I had chili.
Okay. Um, so I'm gonna ask you uh, if you could, starting at 1, in increments of 7, um, count all the way up as far as you can.
Okay. 1, 7, 14, 21, 28, 35, 49, 56, 63, 70, 77. I don't know what it is next.
Okay, so I'm just gonna ask you. Okay, Sommer. So I'm just gonna ask you what you would do in this situation. You're in a movie theater with a bunch of people, and you smell smoke.
I I think I'd go up to like the concession stand area and tell an employee, I mean, maybe they like overcook the popcorn or something, and then let them handle it from there.
Okay. Sommer, just last question. Can you tell me all the medications you take at home?
Yeah. So right now I'm just taking the Zyprexa. Um, I also take vitamin D and calcium and a multivitamin every day, just to try and stay healthy. And then um, I took some other meds while I was in the hospital as a senior, but my psychiatrist weaned me off of those because he thought I was doing really well.
Okay. How often do you talk to your psychiatrist?
I go about every 3 months.
And how does it make you feel after leaving a session?
Well, we just talk about my meds. I go to someone else to talk about like how I'm doing and all of that, and then they just talk to each other. And um, so I typically feel fine. Typically writes me a new script, and then I go back in 3 months and we reevaluate again. So it's just
Well,
a normal routine.
thank you for your cooperation. I appreciate it. I'll be taking care of you the rest of the time. Hopefully, the doctor will come in here and see you, so we can handle the mono.
Okay.
Do you have any questions for me?
Um, do you know maybe how long you think I might have to be here?
It just kind of depends. It depends on how soon the doctor can get in here and kind of do his own assessment of you. And it's based kind of on his judgment, what's going to be best for you.
Okay. Okay.
Okay.
Thank
All
you.
right. Well, if you need anything else, I'm Shae, and you can use your call light. Just give me a ring.
Okay. Thank you.
Okay. Thank you.